Ever wonder what your vaginal discharge is trying to tell you? Let's talk about this. It's not too TMI. I'm Dr. Jen, double-boarded OB/GYN and integrative medicine doctor. So I want to talk about vaginal discharge and what's normal and what's not normal. First of all, the vagina is a self-cleaning organ. So you do not need douches, you do not need anything in the vagina to clean it. Discharge is actually part of that way that the vagina stays healthy. So when we have discharge, we actually help kind of flush out bacteria that shouldn't be there, yeast, fungus, all the things that shouldn't be there, but also keeping the vagina healthy with a normal pH that's acidic. So what could your discharge be telling you? So normal discharge is typically clear or even kind of white. And it really depends on your cycle. Believe it or not, the first week after your period is very different than post-ovulation, which is after 14 days. So the discharge can change, and it's supposed to, because it's supposed to ultimately kind of get more stringy and kind of more clear and thin, and that's sort of during the time of ovulation. That's what some women will use to actually track whether or not they're ovulating specifically. If you notice your discharge is kind of gray in color or has a foul odor, or maybe you're having white discharge but it's clumping and just thick, that could actually indicate a bacterial infection or a yeast infection, and you should see a doctor so you can get treated. If you notice yellow or green discharge, that could indicate a sexually transmitted disease or an STI. Now, even if you see discharge that kind of has bubbles in it, that's not normal. Most people also have irritation and they just sort of notice things are not normal. So that you should be evaluated by a provider. Pink discharge is spotty. So pink discharge is when you have spotting maybe before your period should start or maybe mid-cycle spotting. There's a lot of different reasons for spotting. It could be a structural problem or it could be a hormonal problem. So persistent spotting needs to be evaluated as well. Obviously, red discharge is usually your period type bleeding, and that's when it's bright red. Remember, during your period, you can have, darkish brown discharge, especially at the end as the uterus is sort of emptying and that's what's remaining. But, too heavy of periods should definitely be seen for that. And then certainly when you have discharge that seems to be kind of more watery in nature, excessive, you should definitely be seen to be evaluated to see if maybe there's some hormonal changes that need to be evaluated. So normal for women to have white or clear discharge, even daily. Most of the time it doesn't require someone to wear a tampon. That's too much discharge. So if you notice that you're having these changes, you should definitely seek a provider. And remember, the vaginal microbiome, the health of the vagina, is linked to both the pH of the vagina and having good, healthy bacteria. So I'm a physician and an advisor for Physician's Choice, and I love their vaginal probiotic because it has both keeping the vagina acidic, but also has great bacteria that's supposed to be in the vagina, the lactobacillus species. So those bacteria are actually normally found in the vagina and keep it healthy in general. So not too much TMI. I hope that you have got your answers and your questions answered about vaginal discharge. If you have any more, throw them down here. I'm happy to answer them.